A hearty good afternoon and welcome to the session on endocrinology and infertility. We are glad to have Dr. Meenal Chidgupkar among us today to help us understand the topic. She will take us through that and more in this session today. Doctor, you have the stage.
Namaste. मैं डॉक्टर मीनल चिडगुपकर सीनियर IVF consultant Apollo Fertility Solapur. Today my topic is endocrinology and infertility. So today we are going to discuss what impact of endocrinological organs in infertility, male female. So basically what happens when couple comes to IVF clinic for their checkups, we need to check certain investigations, blood investigations, to rule out any hormonal imbalances are there or not in their body. So the major hormones which are very important in this infertility are we usually check day 2 LH, FSH and estrogen, and also there is an important hormone called progesterone. Another hormone which has big impact on infertility is thyroid. So checking thyroid, serum TSH, T3, T4 free values are important, where we can understand if the patient has any subclinical hypothyroidism, overt hypothyroidism, or hyperthyroidism, or any other conditions associated with this thyroid problems. There is another important hormone which is prolactin, which we usually check to see any hypothalamic, because it is a hypothalamic hormone, and it also impact on this infertility. So when we check day 2 LH, FSH, so uh, patients who are coming to infertility clinics, they must be wondering why our day 2 LH, FSH is usually checked, because those are the hormones which are responsible for the further folliculogenesis. So in IVF cases also, and in IUI, or whenever there is ovulation induction, when we understand these levels, then we can get to know how the folliculogenesis will happen, and subsequent sonographies we can see those changes in the body. In that kind of hormones, when FSH is extremely low, lower than 2. So, and even LH is very low, we call it as a hypogonadotropic condition. So, because their hormones are extremely low. When they are normal, there is normogonadotropic conditions, and when these hormones are very high, we call it as hypergonadotropic conditions, and accordingly we have to change the treatment protocols. So the different hormonal conditions where it has a lot of impact is polycystic ovarian disease. So polycystic ovarian disease, where the LH value is more than FSH, and here we have to go with the oral ovulogens. So basically giving tablets such as letrozole or cyphene, like clomiphene citrate, and accordingly we have to see the follicles are forming or not. And when it is very low hormones, these tablets will not help to form the follicles. So in those cases, direct injections of gonadotropins are required, and with the use of those injections we can get the follicles in those patients. And in certain other conditions we have to check other parameters also. In certain cases, like polycystic ovarian syndrome, which I told, which is association of thyroid problems, sometimes there is a because there is insulin resistance, there is a development of early diabetes in those patients, and we have to check the fasting sugars and like postprandial, and understand if the patient is going into early diabetes mellitus, and we have to treat that patient accordingly. Insulin resistance also causes the changes on the skin. Darkened skin patches are seen on neck or on other surfaces of the body, and also there are a lot of high androgens that are causing hirsutism, that is increased facial hairs, and also hair on body parts at the various sites, and we have to grade them accordingly, and we have to grade this polycystic ovarian syndrome also. So when we see in a more like bigger picture, where we have to understand there are so many hormones, there are so many hormonal places where the body secretes these hormones, even the adrenal hormone or the when the prolactin value is extremely high, we have to check is there any prolactinoma in the body, and we have to treat that also. Certain times these hormonal imbalances are due to some of the medicines which the patient is taking. So we have to check their previous medicines and what they are on and for what the treatment is going on. This is like female scenario where we have to check all these things, and simultaneously we have to check all such things in male patients also. In male patients, when patient comes with the semen analysis problems like oligoasthenoteratozoospermia or other decreased semen parameters, we have to check if they are taking any drugs, which kind of drugs. Certain times, if the patient is on psychiatric treatment, taking lot of antidopaminergic or that kind of drugs, and that may have impact on the prolactin, and that may have impact further on the semen count and the quality of the sperm. So when the patient comes, we have to check in totality both the partners, male and female, for their all medical conditions, their which kind of treatment they are taking in prior. Then we have to do certain blood investigations to rule out any problems. If they have endocrinological problems, we have to treat those problems before we go for the IVF treatment or any infertility treatment, because if the patient has thyroid problems and if we start infertility treatment, they get pregnant, there is a higher chance of abortion. So we have to first treat these endocrinological problems and then further move for infertility treatment. So the thorough investigations are absolutely important. We have to understand properly which parameters these patients are fitting. We have to treat those patients accordingly, and then we have to give proper treatment. And with these treatments, the patients will definitely conceive and they will have their own babies. So, namaste again. I'm Dr. Meenal Chidgupkar, Senior IVF Consultant, Apollo Fertility, Solapur. Here in Solapur, we are treating many patients of infertility. We have completed our 2 years of infertility treatment. Thank you.